Hi, my name is Jerome Carson. I'm a professor of psychology at the University of Bolton. I'm going to tell you about some research we did in March 2020. And we were interested to look at happiness levels between people in the north of England and in the south of England. And this was based on a supposition that given there are differences in health and wealth between the north and the south, would there be differences in happiness? So we launched the survey on the Prolific website and collected 1,600 participants in the space of 2 hours. Unfortunately, many of the participants actually said, well, if you'd spoken to me about 3 months ago, my responses would have been completely different than they are now. At the moment, I'm very worried about this COVID-19 business. And in fact, a lot of people actually sent us similar emails. So it actually ruined our happiness survey. But what it did was it gave us the first indicator of how people in the north of England and in the south of England were feeling about the COVID-19 pandemic. And of course, it was soon after this that the country went into total lockdown. There were two main findings from this research work. The first finding was that younger people, that is people between the ages of 18 and 25, were much more stressed than older people. So we're looking at people between the ages of 60 and 80. The older people seemed much better able to cope on a number of the measures we actually used. The second main finding related to people who were lonely. And what we did was we had given the UCLA brief loneliness scale to all the participants. And when we divided the sample into people who weren't lonely versus those who were very lonely, we found that the very lonely people had 3 times the level of mental distress than people who weren't lonely. So this is a finding, I think, that has also cropped up in other research. So what it suggests is that we really needed to be more mindful of the effects of the pandemic on not just younger people, but more especially on people who were lonely. And it's a shame we haven't been able to repeat that work with the same people and find out how they actually really did get on during the pandemic and how they are now. But interesting research to show that even before the lockdown, people were showing signs of mental distress.